Hello, future nurses. This chapter explores the assessment techniques required to perform the general survey and taking vital signs of your client. General survey is the first part of the physical examination that begins the moment the nurse meets the client. It's an overall review or first impression a nurse has of the client's well-being. It requires the nurse to use all of their observational skills while interviewing and interacting with the client. These observations will lead to clues about health status of the client, and this is done head to toe, front to back, proximal and distal. Future nurses, general surveying is a visual observation. You observe the client's physical development, body and gender, sexual development, their apparent age as compared to the reported age, any skin condition and color, their dress and hygiene, posture and gait, their level of consciousness, behaviors, body movements, and affect. Any facial expressions and speech, you want to observe in the client's behavior if they're maintaining eye contact with the appropriate expressions. You want to know if they're comfortable and cooperative, if they have clear speech, if their clothing is appropriate for the climate. You want to look to see if they're clean and if their clothes are clean and fit, and if they appear to be well groomed. And finally, you'll assess the vital signs of the client. It is a good idea to begin the quote-unquote hands-on physical examination by taking vital signs. The vital signs are described as the measurement of temperature, pulse, respirations, and blood pressure, and given an immediate picture of the client's current state of health and well-being. This is a common non-invasive physical assessment procedure that most clients are accustomed to. The vital signs will provide data that reflect the status of several body systems, including but not limited to the cardiovascular, neurologic, peripheral and vascular, and the respiratory systems. You will obtain the vital signs in the following order. First, the temperature, the pulse, respirations, blood pressure, and screen for pain. When obtaining vital signs from your client, you'll need the following equipment: a thermometer, either tympanic, temporal artery, an electric oral or axillary thermometer, or a rectal thermometer. You want to make sure that it has protective or disposable covers for the type of thermometer that you're going to use. Make sure you have a blood pressure cuff for measuring the blood pressure, stethoscope, and make sure you have a watch or a clock that displays the second hand. Prepare the client for the general survey by explaining its purpose. Ideally, your client should be sitting with feet on the floor and their back supported. The examination room should be quiet and the client should be comfortable. Here you'll learn about obtaining your temperature. Now, temperature can be measured in several different ways. To measure the tympanic temperature, you want to place the probe very gently at the opening of the ear canal for 2 to 3 seconds until the temperature appears in the digital display window. The tympanic membrane temperature is normally about 0.8 degrees Celsius higher than the normal oral temperature. I'm going to repeat that. The tympanic membrane temperature is normally about 0.8 degrees Celsius higher than the normal oral temperature. Now, normal tympanic ranges is 36.7 to 38.3 degrees Celsius, or it's 98 to 100.9 degrees Fahrenheit. To measure oral temperature, use the electronic thermometer with the disposable protective probe cover. Then place the thermometer under the client's tongue to the right or the left of the frenulum, deep in the posterior sublingual pocket. Ask your client to close his or her lips around the probe. You want to hold the probe until you hear a beep with a digital read, which is about 10 seconds or less. Read the probe and dispose of its cover by pressing the release button. The oral temperature range is 35.9 to 37.5 degrees Celsius, or 96.6 to 99.5 degrees Fahrenheit. To measure axillary temperature, you want to hold the electronic thermometer under the axilla or the underarm firmly by having the client hold the arm down. The axillary temperature is 0.5 degrees Celsius lower than your oral temperature. Normal axillary temperature range is 35.4 to 37 degrees Celsius, or 95.6 to 98.5 degrees Fahrenheit. To measure your temporal artery temperature, you want to remove the protective cap from the thermometer. Place the thermometer over the client's forehead, and while pressing the scan button, gently stroke the thermometer across the client's forehead over the temporal artery to a point directly behind the ear. Just like the oral and axillary electronic thermometers, you'll hear a beep, and a red light will blink to indicate a measurement is taking place. Release the scan button, and then you want to release the thermometer from the forehead. The temporal artery temperature is approximately 0.4 degrees Celsius higher than the axillary. Normal temporal artery temperature range is 36.3 to 37.9 degrees Celsius, or 97.4 to 100.3 degrees Fahrenheit. To measure the rectal temperature, cover the probe with a disposable sheath and use lubricant on a thermometer. At this point, you want to wear some gloves and insert the thermometer 1 inch into the rectum. Hold the thermometer in place until the temperature appears in the display window. The rectal temperature is between 0.4 degrees Celsius and 0.5 degrees Celsius higher than the normal oral temperature. Normal rectal temperature ranges 36.3 to 37.9 degrees Celsius, or 97.4 to 100.3 degrees Fahrenheit. Please remember, of these, the axillary is the least invasive and the rectal is the most invasive. Here you'll learn how to obtain your client's pulse. Now, while sitting or standing facing your client, you're going to grasp the client's wrist with your free hand. That's the hand that doesn't have the watch. There's no reason for your client's arm to be in an awkward position, so just imagine you're shaking hands. Use the pads of your first and second fingers, that's your index and middle finger, and then you want to lightly palpate the radial artery. Count the number of beats you feel for in 15 seconds and take that number and multiply by 4. Or for the count of number of beats you feel in 30 seconds, take that number and multiply by 2 if the pulse rhythm is regular. However, count for a full minute if the rhythm is irregular. A normal pulse rate in adults ranges from 60 to 100 beats per minute. You want to record whether the pulse is regular or irregular. Regular is evenly spaced beats, equal length of time between each beat. An irregular rhythm is unequal length of time between the beats, and it's difficult to measure rate accurately. When assessing the pulse amplitude and contour, a normal pulsation is equally strong in both wrists. A bounding or weak and thready pulse is usually indication of an abnormality. Arterial elasticity feels straight, resilient, and springy. Abnormal arteries feel rigid and are typically seen in the older adults. I want you guys to take a minute and now test and feel your own pulse. What does it measure in rate? What's the rhythm? What's the amplitude and elasticity? When obtaining your client's respirations are best done immediately after taking the client's pulse. You don't want to announce that you're measuring the respirations. So without letting go of the client's wrist, begin to observe the client's breathing. You want to ask yourself if their breathing pattern is normal or labored. Observe the client's chest as it rises and falls with each breath. Count the respirations for 30 seconds. Take that number and multiply by 2. Normal resting respiration rate in adults is between 12 to 20 breaths per minute. Observe the client's respiratory rhythms. If it's irregular, count for a full minute. Observe the respiratory depth. The normal equal bilateral chest expansion is 1 to 2 inches. Unequal, shallow, or extremely deep chest expansion and labored or gasping breaths are abnormal. Next, you'll measure the client's blood pressure. Blood pressure is the pressure by circulating blood on the walls of blood vessels. During each heartbeat, the blood pressure varies between a maximum systolic and a minimum diastolic pressure. The blood pressure in the circulation is principally due to the pumping action of the heart. Therefore, blood pressure is a measurement of the pressure of the blood in the arteries when the ventricles are contracted, also known as systolic blood pressure, and when the ventricles are relaxed, also known as diastolic blood pressure. Blood pressure is expressed in a ratio of the systolic pressure over the diastolic pressure. A client's blood pressure is expressed in terms of systolic pressure over the diastolic pressure and is measured in millimeters of mercury. To measure your client's blood pressure, assemble your equipment. You want the sphygmomanometer, the stethoscope, a pen, and recording sheet. Again, to measure the blood pressure, assemble your equipment. You'll need a sphygmomanometer, stethoscope, pen, and a recording sheet. Assist the client into a comfortable position with their legs uncrossed. The room should be quiet. Position the client's arms so the antecubital fold is level with the heart. Center the bladder of the cuff over the brachial artery and wrap the appropriate size cuff smoothly and snugly around the upper arm, 1 inch above the antecubital area, so that there is enough room to place the bell of the stethoscope there. A proper cuff size is essential to obtaining an accurate reading. Be sure the index line falls between the size marks when you apply the cuff. Position the client's arm so it is slightly flexed at the elbow. Put your earpieces of the stethoscope in your ears and then palpate or feel the brachial pulse again and place the stethoscope slightly or lightly over this area. Position the mercury gauge of the manometer at eye level, and then you want to palpate the radial pulse and inflate the cuff until the pulse disappears. This is the rough estimate of the systolic pressure. Release the bulb and allow the client's arm to rest for a full minute. Then you're going to place the stethoscope over the brachial artery. Inflate the cuff 30 millimeters mercury above the point which the radial pulse disappeared the first time. And this is an estimated systolic pressure. Release the pressure slowly, about 2 millimeters per second, by turning the valve in the opposite direction while listening for the Korotkoff sounds. The level at which you first hear faint but clear and consistent heartbeats is the systolic blood pressure. I'm going to repeat that. The level at which you first hear faint but clear and consistent heartbeat is the systolic blood pressure. This is the phase 1 of the Korotkoff sounds. Continue to lower the pressure until the sounds muffle and disappear. This will be the diastolic pressure in phase 4 of the Korotkoff sounds. Finally, note the point at which the sound subsides completely. This is phase 5 of the Korotkoff sounds. When both a change in sounds and a succession of sounds are heard, record the number at which you hear phase 1, and phase 4, and phase 5. Completely deflate the cuff and record the blood pressure as systolic over diastolic. Otherwise, record the first and the last sounds, which again are phase 1 and 4. Optimal blood pressure in an adult is less than 120 over 80. Today, pain is considered the 5th vital sign. Pain is inexpensive to assess and does not involve the use of fancy instruments. Yet, it can be an early predictor of impending disability. It is essential to assess for pain at the initial assessment. When pain is present, identify the location, the intensity, quality, duration, and any alleviating or aggravating factors to the client. Pain intensity measurement tools such as a 1 to 10 Likert scale may be used. Pain quality can be described as dull, sharp, radiating, or throbbing. As the nurse, you want to reduce the burden of untreated pain and facilitate normal function for the client. So you will consider pain to be the 5th vital sign. You want to observe the client's comfort level. You will ask the client if he or she has any pain, and you will make the pain visible. I want to thank you for your time. This concludes the Assessing General Health Status in Vital Signs. For any questions, my contact information is as listed.